I'm Steve Adubato. It is my honor and pleasure, for the first time, it's my honor to interview John Kastanis, who is the President and Chief Executive Officer of University Hospital based in Newark, New Jersey. John, do us a favor. The footprint of University is? Describe it.
It's part of the former UMDNJ, the University of Medicine and Dentistry of New Jersey, which was dissolved by a legislative act over 3 years ago. And subsequent to that dissolution, the academic programs, most of them that were part of UMDNJ, were given to Rutgers University. And from that, we now have the Rutgers health programs. And the hospital itself, which is still on the same campus, is still a major component of the New Jersey operating budget, the state of New Jersey. And we are a standalone university hospital, strongly affiliated with Rutgers Health, fulfilling the academic missions of both the hospital and Rutgers Health. So that's the new footprint of University Hospital.
But you also serve people right in the heart of the city.
Yes, we do, and beyond. But we are a regional academic medical center, as most know. One of the stronger attributes of that campus is we're the only level 1 trauma center.
Explain to folks what that means.
Well, level 1 is the highest level, the highest skill of emergency services that are provided to those victims of mostly, car crashes and fatal shootings. It's the most severe type of emergent treatment that's available.
That's where you would go.
And that's where you would go. It's well known amongst all the municipalities, fire, police, all the emergency technicians that operate ambulances in the area, when we happen to run the 911 system in Newark. But that's where most want to go when there's a real serious traumatic injury.
John, of all the, there's so many interesting developments happening in the healthcare world, and one of the most fascinating that we've read about recently is the Rutgers Cancer Institute of New Jersey at University Hospital.
Yes.
Tell us what that is.
Well, we have a relationship now with a rather well-known cancer program. It's NCI designated as a comprehensive cancer center. So Rutgers, which has the Cancer Institute of New Jersey, for the most part, up until recently based in New Brunswick, has now brought that, that cachet, if you will, that branding, and all the expertise that comes with it to the Newark campus at University Hospital. And I might add, we're very proud of all the cancer programs that we have had to date at University Hospital. In fact, some of the specialties, be it head and neck surgery, orthopedics, we have some really top-notch specialists who treat cancer victims in those particular specialties. But bringing on an NCI designated comprehensive cancer center.
National Cancer
Exactly,
Institute.
the National Cancer Institute. To have them now partnering with us allows us to expand our services. It brings an opportunity for more research, grant funding. It allows us for more earlier detection of cancer, and really more education, spreading the information that really needs to get out into the community.
John, stay on this. It's so interesting. I'm born and raised in Newark, as you know, we've talked about
Yes.
that. We have some mutual experiences in Westchester County, where I used to live, and New Rochelle, and you know very well of your early career in healthcare.
Yes.
But I know Newark and Essex County very well. And looking at the numbers, why is it that a higher percentage, seemingly, if I'm wrong, or correct me, higher percentage of Essex County / Newark residents get diagnosed with cancer later in the process? Why is that?
I think it stems from what I said earlier. We just have not done a good job reaching out with more education and providing more preventative care. The later detections are an issue. I recall that there was a period of time between 2002 and 2006 where the New Jersey Cancer Registry pointed out that there was really a high incidence, something like over 3,700 new cases of cancer during that time span, and the deaths from that same time span were over 3,700. Now, more recently, we've noted that the overall incidence of cancer in our immediate catchment areas has come down, but we still have a lot of patients that are presenting with cancers in areas such as cervical cancer, prostate, breast, oral. These categories still, the incidences do run high. And we really have to do a better job reaching out. And with this new partnership, we feel we're going to have that supplemental support and expertise to help us out with that.
John, the term patient-centered care is talked about a lot. What does it mean?
There's a lot of definitions to it. It's a broad statement.
What's yours?
But you know, being in the industry for as long as I have, it's more
a lot of jargon, huh?
Yeah. But really, the reality is we have to do a better job as an industry, not just at University Hospital, but I think all of our colleagues in healthcare really understand that value-based medicine is what we have to focus on. And when it comes to patient-centered care, we have to do a better job in focusing on the patient and all other aspects of who they are as individuals, their family, their ethnic backgrounds. It's not just the disease, but it's all about the individual patient and who they are all about, and really finding extra support for the care that they need.
But why would that help, particularly with a cancer patient?
Well, with cancer, it's just one of those diseases that we haven't looked at. You know, we have so much research going into it. There's so many private and individual funding campaigns, but we still haven't gotten to the point where we can really find a totally efficacious treatment to beat it. But we're getting closer. Not that I'm a clinician or a physician, but you know, and I don't want to digress too much, but you know, with the breaking down of the human genome and all the research that's now focusing on DNA and the sources of cancer, we're getting really close.
But knowing the patient's history, knowing the patient's family, being more patient-centric does help in the treatment of the patient with
really
cancer.
It's really relevant. And you know, the different components of a municipality, it's not just healthcare, there's housing, there's transportation, there's education.
There are healthcare issues?
You know, healthcare is always at the head of the table. When housing and transport and education, when they're all looking at, you know, their respective issues and what they're trying to do with their respective populations, it pertains to healthcare. We have situations where people in a lifetime are living in low housing projects full of lead. And that lead poisoning does lead to different forms of cancer. And you know, that's a housing issue, but ultimately it becomes a healthcare issue. So there are a lot of social determinants that come into play, but it all leads to healthcare at some point. And unfortunately, a lot of it leads to cancer. Final
question. I've asked a lot of leaders who come in here, because I'm interested in leadership, wrote a book called Lessons in Leadership, and I want to ask you, I never expected this question. What's the number one lesson you've learned about leadership?
Leadership is something where I've been given titles, as you just announced my title earlier. Titles are just one thing, but it doesn't really win you respect and faith in who you are as a leader. You have to earn that. And that was my biggest lesson to date, that no matter how much experience I have, what I bring to my leadership role, now currently at University Hospital, you have to win the respect and the recognition of the people that you're leading.
Leadership is not a title.
Nice.
John, well said by John Kastanis, who is I'll say his title anyway, he's the president and CEO of University Hospital in Newark, and one of the underwriters and supporters of us at Public Broadcasting. Thank you so much, John. Appreciate it.
It's my pleasure.
We'll be right back right after this. Thank you, John.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the New Jersey Education Association, Wells Fargo,
Qualcare Inc.,
Berkeley College,
the New Jersey Office of the Insurance Fraud Prosecutor,
Gary's Wine and Marketplace, and by the Community Food Bank of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus, New Jersey has been produced in partnership with TriStar Studios.